A fistulagram is done by first counseling the patient as to what kind of procedure this is, and obviously we tell them about the fistulagram. And in so doing, we give them some sort of idea of the risks and benefits. The risks are that anytime we invade the vascular access, there can be difficulties with the vascular access. We can injure the vascular access. This is always a problem, but the chances of that, we've learned, are very, very low. Because of this, we do take the risks, and we have suffered the benefits of those risks. And those benefits are that those vascular accesses work better, they provide better clearances, and the patients therefore benefit by doing better and living longer. The way the fistulagram is done is we take them to the interventional unit, and this can be done in the hospital, it can be done in many surgery centers, it can be done in interventional centers. And what is done is they're placed on an examining table, and the arm is fully, or the extremity is fully cleaned by a soap-like solution that helps in removing any sort of bacteria, because obviously we're invading the vascular tree, and because of that there's always the possibility of infection. We eliminate this by the types of soaps that we use. After we've used the cleaning solution, then we provide some local anesthesia, usually in the form of lidocaine. And after providing the lidocaine, then we cannulate or stick the access. After obtaining the access, then we can take the pictures of the access, and by this then determine if there's any difficulties or problems. There are several important things to realize when we need to do a fistulagram, and they are that the patient needs to be NPO or have nothing to eat or drink for about 6 hours. Now generally the 6-hour limit is for solid foods, and nothing to drink, that is clear liquids, for at least 3 hours. And this is to protect the patient so that there's no aspiration, there's no difficulty, because we use various sedating medicines to help with the pain control. If they eat and we provide the pain control, then they can get nauseated, and because they're nauseated, they can get sick and potentially have food get into their lungs. And obviously this is a complication, a major complication that will require hospitalization. And therefore, it is essential that they not eat prior to the procedure, or we are not doing the procedures because we cannot sedate them. The next is that they need to have some sort of individual that comes with them, that accompanies them, because we're not sedating individuals and then letting them drive afterward. So it is essential that they bring some friend or some loved one with them when they come to our interventional unit. The last point is, if any of our dialysis patients are on Coumadin, a blood thinner, we need to be aware of that. And prior to their procedure, we will monitor and see exactly how thin their blood is, and take appropriate precautions. If their blood thinning is too thin, then the procedure is canceled because of the potential complications. Otherwise, we proceed on and fix the access.